As a senior social worker at Bluewater Health, Helen Clark follows her professional standards to the highest level. Her ethical behavior and integrity have earned her the respect and admiration of her colleagues. She is committed to quality improvement and advocates for the patient and family in all aspects of her work. She understands the significance between healthy working relationships amongst healthcare teams and the patient and family experience. These harmonious interactions extend beyond Bluewater Health, where Helen is well respected within the community, serving on numerous external committees. Helen is currently participating in the mental health team renewal, where she is utilizing her skills and knowledge to learn and grow side by side with members of this multidisciplinary program. Helen's passion to provide exemplary healthcare to patients and families has also led her to take on the role of RNAO Best Practice Spotlight Organization Champion and lead for the Best Practice Guideline, establishing therapeutic relationships. Her daily practice demonstrates the highest example of the therapeutic relationship, and she will model the way for others to develop their skills and expertise. Helen views all people as experts in their lives, respecting individuality and diversity in each and every encounter. She consistently demonstrates the ability to listen and review situations with sensitivity and objectivity, focusing on a collaborative approach to discover a resolution or solution if required. In her role as Critical Incident Stress Management Lead, she provides active, non-judgmental listening for staff members, and they know by her stellar reputation they can confide in her as they work together to ensure excellence in patient and family-centered care. Sharon Dearing is an amazing individual who truly understands what it takes to create an exemplary healthcare experience. She brings her kind, caring, and compassionate attitude to each patient, family, or staff member she encounters as a volunteer in the ultrasound department. Sharon has a way of ensuring that patients are comfortable and at ease when they are in the department. She extends a warm welcome to patients and walks alongside them, acting as an escort and ambassador every step of the way. She makes what could be an anxious experience better by her presence. She will offer an extra blanket to keep someone warm and comfortable, or check in with patients to let them know it won't be much longer. She is cheerful and responsive to the needs of everyone while maintaining the confidentiality and privacy required of a healthcare setting. A true leader, Sharon has taken on the role of captain for the ultrasound volunteer team. She ensures that all new volunteers are given a warm welcome and a thorough orientation to their role and introduces them to the staff in the department. Sharon takes an interest in each of the volunteers she works with and checks in on them often if they are ill or going through a hardship. Showing great respect and admiration for the work that the technicians and volunteers do, Sharon crocheted scarves for them to show her appreciation for creating such a great environment for patients and families. Sharon has often said that she gets so much from volunteering, but it's our patients and staff that benefit most from Sharon's contribution. Beth Donald is a registered practical nurse in continuing care at CEEH of Bluewater Health. She has been a member of the Bluewater Health team for over 40 years. In that time, she has garnered the respect of her patients, families, colleagues, and managers for her strong work ethic and kind, compassionate, caring way. Beth goes above and beyond for her patients, whether she is advocating on their behalf or showing compassion when caring for palliative patients and their families. She makes sure everyone's voice is heard and treats all patients as individuals, receptive to listening to their needs and concerns. Beth is passionate about being an employee of Bluewater Health and is devoted to her role as a nurse. She stays informed by keeping up to date on policies and through continuing education courses, such as palliative care nursing, pain and symptom management, advanced foot care, diabetes management, and pharmacy updates, just to name a few. Beth's integrity as a nurse is demonstrated consistently. She is identified by her coworkers and the management team as their go-to resource person. At the same time, she seeks advice from others as needed and is receptive to any suggestions from the interdisciplinary team. Beth loves to share her knowledge. She has served as a student preceptor and staff mentor numerous times. She is a phenomenal teacher and takes every opportunity to assist others to learn. Her co-workers state that she's always teaching. She encourages everyone to continually learn and enrich their lives and careers. She is committed to her own personal values, which truly mirror those of the organization. Debbie Kafford has a very strong commitment to her role as a clinical pharmacist at Bluewater Health. She demonstrates genuine compassion for patients and families. She is always trying to help and is an extremely friendly and pleasant person, making everyone around her feel comfortable and at ease. She goes out of her way to ensure patients receive the best care possible and is proactive in working to prevent errors and to find solutions to problems. Debbie demonstrates strong accountability for all of her work and actions. She is generous in terms of sharing her knowledge and teaching new pharmacists, even inviting them to contact her at home when questions arise. Debbie is respectful of the values of her colleagues and works with them in a polite and courteous way, showing a genuine interest in their work and well-being. She listens to problems and patiently helps to solve them. Debbie is not only friendly, kind, compassionate, and caring to patients and coworkers, she is a member of many important committees that enhance the care of patients and improve pharmacy's responsiveness and accountability. She is an integral member of the Pharmacy and Therapeutics Committee, and she is the go-to person for questions about pain control and palliative medicine. Debbie is a competent and knowledgeable professional who continually goes above and beyond to help in any way possible, whether it's for patients, families, physicians, or colleagues. Pandu Shetty is caring, compassionate, and profoundly respectful of everyone he meets. As medical director of the medicine program, he is always available to deal with patient issues or to answer questions. He is friendly, approachable, and highly knowledgeable, and his interaction with his patients and their families is compassionate and deeply caring. As the consummate healthcare professional, he holds himself personally accountable for ensuring all care provided at Bluewater Health is consistent with the best available evidence. Dr. Shetty lives and breathes the core values and ethics of Bluewater Health. His commitment is shown by the outstanding work he has done to promote and develop patient order sets, recognizing that patients benefit when medical care is standardized to the greatest extent possible. His work promoting hand hygiene to physicians has contributed greatly to our improved performance in this area. Dr. Shetty is an outstanding proponent of interprofessional care, recognizing the essential role that each member of the team plays and highly valuing every person's contribution. In instances when challenged, he is unfailingly tactful and courteous. He strongly advocates for what he believes to be right for patients and families, while carefully taking into account the point of view of others. Dr. Shetty is constantly looking for and creating learning opportunities. His passion for sharing knowledge is shown by the work he puts into organizing grand rounds for the whole organization, during which we are educated by outstanding medical experts in a broad range of clinical areas. Pandu Shetty is recognized at Bluewater Health as a physician leader and model of what all healthcare professionals strive to become. Volunteer Helen Taylor greets everyone with a smile and goes the extra mile for patients, families, and staff. She volunteers in mammography and is a remarkable asset to the department. She gives 100% effort at all times and has rarely missed a shift. If she is going to be absent, she makes sure to cover her hours so that the department doesn't go without a volunteer. By doing so, she has recruited new volunteers to the mammography department. Helen takes the time to talk to the patients, and when she senses they are nervous or uncomfortable, she spends extra time with them to calm them down. She will then pass this information on to the patient's technician so that they are aware of the patient's concerns from the start. Helen is conscientious about confidentiality. She is very careful not to mention anything private within other people's hearing, and is careful to treat everyone respectfully and with dignity. Helen has a special way of brightening the day for our staff. She approached a local florist about donating flowers to our patients. She picks the flowers up before her shift every other week and distributes them to our patients with a smile and often a hug. This gesture goes a long way to brighten the day of our patients. She also places a flower at the front registration desk to brighten our environment. Helen goes out of her way to make the patient experience more comfortable.